Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. In a recent Lifestyle Medicine Update, I explained that many people with high LDL cholesterol, which is the bad cholesterol, and low HDL cholesterol, which is the good cholesterol, can often lower their LDL cholesterol into the safe range for cardiovascular disease by dietary and lifestyle changes, including reducing intake of foods high in saturated fats, trans fats, cholesterol, deep fried foods, breaded foods, and by increasing their intake of cholesterol-lowering soluble fiber, which you find in foods like beans and peas and oats, and it's also by having more low glycemic fibrous fruits and vegetables like non-sweet apples as an example, and the white rind of citrus fruit. That's where you have a lot of pectin fiber under the skin of an orange or a grapefruit, as well as by consuming more ground flaxseed, psyllium husk fiber. All of these things help to lower the bad cholesterol. As well, endurance exercise and weight loss are also helpful to lower the bad cholesterol in many cases. However, the strategies that lower the LDL cholesterol don't always raise the HDL cholesterol. In fact, some of the strategies that I already mentioned, like eating less saturated fat, in some cases actually further lowers the HDL while it's lowering the LDL. Now, this is important because studies like the Veterans Affairs High-Density Lipoprotein Cholesterol Intervention Trial, how about that for a clinical study? The Veterans Affairs High-Density Lipoprotein Cholesterol Intervention Trial. Well, it showed that the rate of coronary artery disease, the rate at which your coronary arteries narrow, is reduced by raising your HDL as an independent risk factor. So the higher your HDL, the less likely you are to clog those really important blood vessels in your heart. So it's vital to get your LDL into a safe range, but it's also important to raise your HDL level if it's low, as HDL helps to remove plaque from the artery wall and open it up. So in a recent update, I provided studies showing that you can usually raise your HDL to a mild to moderate degree depending on the individual. There's a wide range of how one person varies in their response to the next, probably due to genetic factors. But the ways that have been shown to raise HDL are by reducing your waist circumference if you're a little bit overweight, quitting smoking if you're a smoker, performing more aerobic exercise, eating a handful of cashews every day, using extra virgin olive oil, and by consuming avocados on a frequent basis. But in addition to this, there are two supplements that have also shown a tremendous ability to further elevate the HDL levels in human clinical trials. And these include the Indian-based herb known as Gum Guggul, as well as the more well-known artichoke leaf extract. So today I want to focus on Gum Guggul studies, and next week we'll look at artichoke leaf extract as it relates to raising HDL levels. Now, studies in Asia and India over many years have shown that Gum Guggul supplementation lowers LDL cholesterol in 70 to 80% of people that use it as a supplement, and it helps to bring their cholesterol down. On average, it appears to lower the LDL cholesterol by about 30%, which is highly significant. But there's about 20 to 30% of individuals who fail to respond to Gum Guggul supplementation, likely due to strong genetic factors. And those genetic factors are usually the person would have an inability genetically to make the LDL cholesterol receptor that clears cholesterol from the bloodstream. So even in those cases, Gum Guggul is likely not going to be effective. But in the 70 to 80% of people who respond well to Gum Guggul, there's also an associated increase in the HDL by 4% on average, meaning that many individuals can take Gum Guggul to reduce their LDL cholesterol, and it also helps to raise the HDL cholesterol. And this is really good news for people with stubbornly low HDL cholesterol, which is often the case. So how does Gum Guggul work? Well, to the best of our knowledge, the active ingredient in Gum Guggul, known as guggulsterone, prompts the liver to take more of the bad cholesterol out of the bloodstream. So it extracts it from the bloodstream. And then once it's in the liver, it converts that cholesterol into bile acids, and then it excretes it through the bile duct into the intestinal tract. And when you have a bowel movement, it's leaving your body. So let's just walk through this for a second. The cholesterol that's floating around in your bloodstream right now, in your bad cholesterol, the LDL, gets taken up by the liver cells. That cholesterol gets converted into bile acids, secreted into the bile duct and into the intestinal tract, and then when you have a bowel movement, it leaves the body. So it's taking that LDL out and it's lowering the LDL and it's converting it into bile, which you then are excreting with each bowel movement that you have. It's a clever little system. And so that's how it lowers the LDL. But it also appears that Gum Guggul, or these Guggul sterones, prompt the liver cells to synthesize more of the HDL, which goes out into the bloodstream, where it removes cholesterol from the artery wall and removes it so it opens the artery wall up, takes that cholesterol back to the liver as well, and the liver can take that cholesterol, convert it into bile acids, and secrete it into the intestinal tract, and it leaves your body with a bowel movement as well. So it's lowering the LDL and raising the HDL, and that's good news for cardiovascular disease risk. So in some cases, Gum Guggul can be a great natural addition to an LDL lowering and HDL raising program. Now, very conveniently, it also has anti-inflammatory effects, which may be helpful in cardiovascular health as well, and it may also relieve some joint pain symptoms along the way. So Gum Guggul, what is it? It's the resin from the mucal myrrh tree in India. And the most common side effect of Gum Guggul administration is that in about 9% of people it causes a rash, which usually occurs in the first 7 to 10 days of using it. And there's no way to know in advance who's at risk for developing this rash, unfortunately. So it's really trial and error. But if the rash occurs, you just simply discontinue using Gum Guggul and the rash disappears. So it's not a high-risk situation, and most people don't have that reaction. But it's the most common of all the side effects that are associated with Gum Guggul. So I like to provide patients with a supplement that contains both Gum Guggul and artichoke leaf extract together, as these two natural agents kind of work synergistically to lower LDL and raise HDL in many cases. So in the next Lifestyle Medicine Update, I'll cite the evidence for the use of artichoke leaf extract so you can better appreciate how to use these natural agents and how they work together to improve cholesterol readings, both LDL and HDL, and how they can even lower triglyceride levels. The effective therapeutic dosage of Gum Guggul is 3 grams per day, with a supplement that is standardized at 2.5% Guggul sterone content. So it has to be a standardized grade. It's just one more natural and effective way to help lower LDL and raise the HDL for many people. So I've included the references for this information in the text below. Thanks for watching, and I'll see you next time.